Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Thank you for joining us for this edition of Being Well. My name is Lori Casey, and I'm so happy that Lisa Cornwall and Debbie Griffin from Paris Community Hospital Family Medical Center are here today to talk to us about type 1 diabetes. It's a big topic, and we've got a lot to get through, so let's get started. Why don't you first explain, either one of you, the difference between type 1 and type 2 diabetes?
Okay, I'll be glad to do that, Lori. Thank you for having us. Type 1 diabetes is where the pancreas stops producing insulin production. There are beta cells that are produced by the pancreas that normally produce insulin, and in type 1 diabetes that process is totally deficient. So the beta cells stop producing insulin, and therefore a type 1 diabetic needs to be supplemented with insulin injections to live. Type 1 occurs in 5% of the population. The other 95% of population of diabetics are type 2. Type 2 is a different process. It's generally speaking, the pancreas is producing insulin in the beginning of the disease process. In fact, too much insulin production occurs, and the liver is dumping glucose at night when we sleep, and our tissues and cells are not accepting what insulin is being produced. So the difference is with type 1, you automatically go on insulin therapy as soon as you're diagnosed. Type 2, insulin therapy can be implemented later in the disease process, but in the beginning, not so.
Because they'll put them on a diet or change and sometimes that can reduce or get rid of the diabetes.
That's right.
So you had a son diagnosed with diabetes at a very young age. Can you tell us what that was like, raising a son? Because how young was he when he was diagnosed?
He was 16 months when he was diagnosed a type 1 diabetic. His father, my husband, is a diabetic. He is type 1, and he was diagnosed at age 14. And when we went through getting married, we went through genetic counseling, and the risk of type 1 diabetic being born to a parent of diabetes type 1 was only 3 to 5% chance, so very small percentage, and he developed it, our son, who was 16 months old at the time. The symptoms at that point were very acute. He was sick to his stomach, urinating quite frequently, and drinking a large amount. So being in the healthcare field, I felt that it might be his sugar, and we checked it, and it was 700 plus at the time. So we were admitted at Carle Hospital in Champaign-Urbana and stayed there for a week at the time, and it was very frightening for him and us. He was on insulin injections starting at nighttime and testing his sugar 4 to 6 times a day, and for a 16-month-old, that's very difficult.
Oh, I bet.
So the treatment has come a long way, and we're very fortunate to have new analogs with insulins. Back then, the insulin that was used for him, when you gave him the injection, he had to eat, and it was longer acting insulin, which combined with other insulins he was on made him more prone to low blood sugar. You gave the insulin, had to wait 20 minutes, make him eat food, and hope he did. But now we have insulins that you can actually dose after a meal, so it's much more conducive to toddlers.
So is having type 1 more dangerous than type 2, or can they both have the same long-term health effects?
They both have the same long-term health effects if their sugars are not controlled. There are some differences, different complications with type 1 as opposed to type 2. Type 1, like Debbie said, you have to be on the insulin. You have low blood sugars, which type 2 diabetics can have as well. They have they can go into a condition called DKA, which is where the body is breaking down and using fats as energy as opposed to the sugar. That ketones in your blood are very dangerous. They can be poisonous, so you end up in the emergency room, very serious condition. That happens more with type 1 when your blood sugars get too high and there's not enough insulin present, as opposed to type 2. Long-term complications, retinopathy that causes blindness, kidney damage, can lead to dialysis, neuropathy, numbness, tingling, loss in sensation in your feet and legs, increase for heart attack, strokes. Those are all long-term complications of both type 1 and type 2.
So what is it about diabetes that can create those long-term health effects? What is the diabetes doing to their body that can create heart disease later on in life?
The high blood sugars, the high amount of glucose in the bloodstream damages the small vessels, and that's why the kidneys, the eyes, the nerve endings are the ones that are affected, because they're the small endings.
So your son was diagnosed at a very early age. At what age range can people be diagnosed with type 1? Can you get it in your 20s, or if you're going to get it, if you're going to have it, will it be much younger?
Sure. You can still get it in your 20s. Even I've seen people in their 30s, develop type 1. Generally speaking, it used to be called juvenile diabetes. And it was mainly, under the age of 20. But there are patients that are very thin in stature that do develop type 1 diabetes at a later age.
Okay. So is the diagnosis for type 1 different than for type 2? Or are the testing methods the same?
The testing methods are the same.
Okay.
They do lab work, check your blood sugar, check a fasting blood sugar. Obviously, if you come sick into the hospital, they're going to do blood work. If your sugar is above a certain range, they know that you're a diabetic. Then from there, it's just differentiating between type 1 and type 2, and it all depends on the systems or the symptoms you present with, and how critical you are at that point.
Okay. Now, just to review, what would be a normal blood sugar level?
Fasting blood sugar, which means first thing in the morning before you have anything to eat or drink, in a non-diabetic should between 70 and 100 is normal. 101 to 125 is pre-diabetic.
Okay.
And then anything greater than 126 is diabetic.
Okay. So if you have, with type 2, you can be pre-diabetic. You really can't, is it true that you can't really be pre-diabetic with type 1?
That's correct.
Okay. So does a type 1 diabetic manage their diabetes the same way a type 2 does, or is it a little bit different process?
Essentially, it's the same as far as testing one's blood sugar. However, with type 1, they go directly on insulin.
Okay.
Upon the diagnosis.
Right.
But often with type 1s, there are multiple daily injections, or even go so far as an insulin pump therapy, which doesn't mean that their diabetes is any more severe or non-controlled. It actually gives more flexibility to the diabetic, to the type 1 diabetic. But they still should, type 1 or type 2 should still be testing their sugar daily, depending on what medication they're on as to how frequently they test, as well as annual labs such as a lipid panel, cholesterol, checking their glycohemoglobin, which is a blood test that determines how well the blood sugar is controlled over the past 3 months, getting their eyes examined, dilated on an annual basis, an annual foot exam. So essentially, the care is the same. It's just what medication and diet and exercise program they're on.
Well, let's talk about, say there's parents out there watching and they have a child with diabetes. What advice can you give to them? You've been through it. What advice can you give to parents on how to, help their child manage diabetes?
Well, I had a very good educator that helped us get through the initial diagnosis. And she gave me some very good advice as a parent to control the diabetes. Don't let it control you or your child's illness. So I tried to make it as normal as possible for my son. I educated his teachers, everyone that he was around. I let them know about the disease, the process, the treatment, and tried to make him as normal as possible. If he wanted snacks at a birthday party, he had those snacks, but we adjusted then his medication accordingly. And to be in close contact with your healthcare provider. That's very important. Get a provider that you're comfortable with, that you can, call freely and ask questions. Have a nurse educator like Lisa. It's very important that you can be in constant communication with them, and the registered dietitian, the whole healthcare team. And if you see signs of psychosocial problems, anxiety, or depression, bring that up to the healthcare provider so they can get your child and your family help, because it's a chronic disease, and there is a lot of depression that can go along with that. So being open communication with your child and with your healthcare team is very important.
Lisa, go ahead, Lisa.
I would just let them know that they're not alone. If they have questions, reach out, to your healthcare team. There's other parents out there, support groups that can help them cope, because it is a lifestyle change when you're diagnosed, especially when it's your child.
Yes.
So reach out to your healthcare team, your educator, other parents who may be experiencing the same thing, and just let them know that they're not alone.
Does it get more challenging as your child turns into a teenager and they want to strike out and be more independent? Do you see more non-compliance in teenage diabetics, or at that time are they used to it?
Generally speaking, yes. We were very fortunate. Our son has done quite well, and has had good glycohemoglobins and good health. He thus far has no complications, so we're very blessed because he's had it for 25 years. But generally speaking, the teenage years can be difficult because of the growth hormones in their body, and the different hormones that can regulate the sugar. It makes it a little more difficult. Physiologically speaking, not only emotionally speaking, wanting to be independent and do as they wish. But that's where the new forms of therapy, and including the insulin pump, comes into play, because it gives them much more flexibility to do so.
What about, is there a difference in how it affects boys versus girls when they get to those teenage years, girls and hormones, boys versus and hormones? Do you notice anything different?
Well, with girls around their menses, yes. It generally plays a little more havoc on the blood sugar. You'll see some dips and then highs, right before the menses and then during it.
So Lisa, what would you say to parents out there that maybe their teenager now went from being a good diabetic as a preteen, and now all of a sudden they don't want anything to do with it, or they do not want to listen to mom or dad about their diabetes?
Roll with the punches, be there to be supportive of their teen, but you got to keep a close eye on it too, and make sure it's not getting out of control. If it is, take them to the doctor, contact the educator. If they don't want to have any part of mom and dad controlling them, just send the child in, the teenager. Sometimes when mom and dad's not around, we get a little bit more of the story. They open up a little bit more. So you got to have some lenience there, kind of roll with the punches, but yet just be supportive.
So what are some of the things that you might see in some of your teenage diabetics that you're counseling? What are some of their complaints or concerns, or
one is eating. They don't feel like they can be normal when they eat, although they can be. Insulin pumps, we can dose insulin based on how many carbohydrates they eat. Just teaching them that method of how to calculate and give insulin doses. So if their friends are going to go out for pizza on Friday night, they can join in, join in as well. Exercise, a lot of them are playing sports, being active, and therefore there's different set of rules, and you need to be a little bit more cautious. You need to have a snack before you go out and be active, or participate in vigorous exercise. So it's just things like that, some lifestyle changes that we've kind of got to work around and come up with a new game plan for.
So what are some things that you instill in those teenagers so that they become responsible diabetics for the rest of their life? What are some things that you taught your son or dealt with your son on that make sure that in his 20s, 30s, 40s he's compliant?
Well, first of all, at a very early age, as soon as he was diagnosed, we talked about the disease, what it was, how to deal with it. We used a lot of role play. So he had, actually, it was like a board that he would use and test this. It was a lion, actually, a pin board, and he pretended he was testing the lion sugar. So a lot of role play, you know. And we talked freely about it, and just open communication, and tried to just make him as normal as possible, but did at the same time explain, you know, the consequences of bad decisions.
That's what I was going to say. How do you talk to your child about, you have a chronic disease that's serious, but not, I mean, have them realize the severity of it, not scare them?
Right. It's hard because you're scared yourself as a parent. You know, automatically you think of what will happen down the road, and you just take each day, like Lisa says, roll with the punches. Take each day and do the best you can.
So what about as the type 1 sort of develops into their 30s, 40s? What are some things that they need to start looking out for as they start to age?
They definitely need to take care of their eyes. Going to the eye doctor, getting a dilated eye exam yearly is extremely important. Taking care of your feet, making sure they're clean and dry, there's no puncture wounds, blisters, openings, sores, anything like that that's not healing, or maybe that's looking red. Just taking care of your whole body in general, you know, nutritious, well-balanced diet, getting plenty of exercise, getting plenty of sleep. Just all those things that normal non-diabetics do on a daily basis. They need to be doing the same for themselves.
So you talked about diet. Let's talk about some components of what would you consider to be a good diabetic diet, or eating, maybe not diet, maybe eating plan.
Well balanced. You know, when you're imagining a plate that you're eating from, half of it should be a non-starchy vegetable, green beans, lettuce, broccoli, carrots, cauliflower, all that kind of good stuff. A fourth of it, you can still have a little bit of your mac and cheese or your rice or your starch or potato. The other fourth should be a piece of meat about the size, the palm of your hand. But when you're diabetic, the one thing that shoots your sugars up is the carbohydrate content. So you really need to be cautious in looking at labels and calculating how many carbohydrates you are eating.
So what should, is it grams per day, or how many, I don't know how you calculate it, how much carbohydrate should a diabetic have per day?
Normally we go per meal, and it's going to be different for men and women. Women should try to stay between 45 and 60 grams of carbs per meal, 15 per snack, and the male population 60 to 75 grams per meal, 15 to 30 per snack, and try to be consistent throughout the day.
And carbs are not just sugars, they come in many, many different forms.
Many forms, absolutely.
Such as?
Your breads, pastas, rice, crackers, fruits have carbohydrates in them, milk and yogurt has carbohydrates in them. Potatoes, corn, and peas are very high in carbohydrates, although most people think of them as a vegetable.
Right.
In our world, they're more of a starch.
Right. So not sugar doesn't, well, sugar elevates blood sugar, but those carbohydrates do too. Do proteins elevate blood sugar in any way?
Carbohydrates, not for the most part, they don't. However, if it's a piece of meat, like red meat that's high in saturated fat, then that can affect your sugars as well.
So the fat in the meat can make things go up.
Yep.
Are there foods that diabetics should avoid?
The only thing I tell my diabetics to avoid is regular pop.
Yeah.
And whether you're diabetic or not, regular pop is colored sugar water, and it's going to do nothing but send your blood sugar through the roof.
What about diets? Diet soda is okay? Nutritionally, it's probably not the best thing to have. But
We say usually one a day, you know, and caffeine-free is better if you can do that as well.
okay, why caffeine-free? Just for diabetics?
Well, with diabetics, some type 2 diabetics tend to have more high blood pressure as well,
okay.
and caffeine affects the blood pressure.
Okay. What about alcohol? Glass of wine here and there. Is that definitely a no-no, or?
Anything in moderation.
Yep.
You know, we'd like to limit the amount of alcohol. Obviously, you're consuming a drink or two, you know, of an evening. If you are drinking, the important thing is that you need to eat along with it.
Okay.
Because alcohol has an unexpected effect on your blood sugar, and it can drop you.
Okay. So have diabetic medications changed over the years? Are they getting better? Is that what allows a diabetic to maybe have a little piece of cake? Whereas maybe 20, 30 years ago, you couldn't have any of that stuff?
There are many new diabetics on the market. Within the past 15 years, it's just really skyrocketed because we understand more due to research the pathophysiology of type 2 diabetes. So there are medications that target actually the kidneys to excrete glucose from the urine. There's medications that target the cells to make the cells more sensitive to the insulin that your body's producing. There's medicines that target the liver to not excrete as much sugar. So there's different facets and different pieces of the puzzle that we can use to treat type 2 diabetes. So with that, I would say yes. And I think that studies have also proven that you can have a little bit of carb with sugar, such as a piece of pie, and just do without the piece of bread with the...
It's a trade-off.
It's a trade-off.
Kind of
It's the
thing.
total carb amount, like Lisa had talked about, that we need to look at.
Okay. What are some things that people should be talking to their doctor about if they're type 1? First of all, how often should a type 1 be seeing their doctor or their diabetes educator?
Normally every 3 months.
Okay.
3 to 6 months, depending on your therapy. Sometimes, the insulin needs to be seen every 3 as opposed to every 6. Checking your A1C, seeing if your sugars are in control. If they're not in control, what can we do about them to get them back in control? Obviously paying attention to your feet, your kidneys, just your overall health in general. What are your cholesterol numbers? What is your blood pressure? All those parts that go into making us healthy in general.
Is insulin adjustment something that is constantly, like you said, as new medications come out, is that something that just because you've been on this for 5 years, there may now be something better out there?
Yes, and illness can affect the blood sugar, it can affect your insulin dosage. So if you see we usually teach our patients, if you see your sugar fluctuating, if it's above 200 on a consistent basis, that they need to contact our office and we'll adjust the medications.
Okay, so the diabetes educator can do the adjustment, doesn't necessarily have to be your family practitioner or your doctor?
I communicate with the physicians.
Okay.
I can't do anything on my own, but we communicate. They can come see me, tell me what's going on, bring me their logbook, and then I'll consult with the physician, the family provider, and together we'll make a decision together.
Well, we've just, in this last minute or so, can you just give us kind of some good advice for someone who has type 1 diabetes for how they can successfully manage that and live a healthy and happy life?
Well, as the nurse educator and the doctor told me, you control the diabetes, don't let it control you. Make it a part of your life. Don't be frightened of what can happen, because it might not ever happen, complications. In fact, there was a study done, a DCCT trial on the UKPDS, that clearly correlated blood sugar control makes a difference. If you can keep your sugar in a good range, keep your glycohemoglobin 7% or below, that's a long-term test, you might not ever develop those long-term complications. It can cut the risk as high as 75% down of developing complications. So just be open, talk to your healthcare provider, and take control of it. Don't avoid it.
Okay, Lisa, do you have any advice?
That's very good advice.
Well, ladies, I appreciate you for coming over to Being Well today and sharing really good information on type 1 diabetes. Thank you so much.
Thank you.
Thank you.
There is new hope for people who suffer from hair loss. A new study indicates hair can be restored using a person's own cells. Unlike traditional hair transplant techniques, this method could potentially grow new hair follicles in hair loss patients. The early research has been done using human hair on mice. Clinical trials on humans could begin in 3 to 5 years. The study appears in the journal Proceedings of the National Academy of Sciences. Early detection for diseases such as lung cancer can save lives, but exactly who needs to be screened is something doctors are trying to figure out. Reporter Holly Furford tells us about a new trial that may offer some answers.
Lung cancer survivor Donna Craig probably would not be alive today if she hadn't been screened for lung cancer. Craig was a smoker for most of her adult life, then saw an ad in the local paper that caught her attention.
That said, if you've smoked a long time, we're looking for you. So I thought, well, it wouldn't hurt, so I signed up and had the first scan, negative.
She went back the next year.
Second scan, negative.
And a year later.
Third scan, large tumor. I still had no symptoms of any kind. If it hadn't been for that test, I wouldn't be here.
Craig was screened as part of a national study where she got a spiral CT scan like this one. Knowing who to screen is vital because there's a high false positive rate. But this study and others have shown if you focus on current or former heavy smokers like Donna, more of the suspicious findings really are cancer. While lung cancer is the biggest cancer killer of men and women, diagnosing early can change that.
If you catch it late, the chances of surviving the disease are poor.
Today, Craig is more than 7 years cancer-free.
It feels wonderful. I feel very, very lucky and very grateful.
For today's Health Minute, I'm Holly Furfer.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston.